After 54 years, Dr. Anthony Fauci is stepping down from the National Institute of Allergy and Infectious Diseases next month. Throughout the years, he's guided the country's response to the AIDS crisis, Ebola, and of course, COVID-19, where he became a fixture in American households. And even on this show, he appeared nearly 20 times during the pandemic. I used to joke he was our co-host. His work to encourage vaccinations likely saved countless lives. But he was also villainized by many on the right that opposed the shutdowns and mandates meant to curb the virus's spread and used Dr. Fauci as the symbol of their attacks. And joining me now is Dr. Anthony Fauci. Dr. Fauci, it's good to see you in person.
Thank you very much,
I think
Chuck.
this is the first time we've been in person since the start.
Yes, exactly.
Of this pandemic.
Indeed.
And I think none of us knew where we were going on. I want to begin by seeing what insight you have on what's going on in China. Let me just put up the headlines for the audience here. They're seeing some protest, unrest over COVID lockdowns is the headline in the New York Times. Fear of quarantine camps is shutting down Beijing. China's COVID protests grow after an apartment blaze killed 10. I mean, you're seeing things that we saw in this country when people didn't like how COVID responds. What is going on in China, and why do they seem to be in a worse place than anyone else in the world?
Well, their approach has been very, very severe and rather draconian in the kinds of shutdowns without a seeming purpose. I mean, if you're having a situation, if you could recall, almost 3 years ago when we were having our hospitals overrun, you remember the situation in New York City, you had to do something immediately to shut down that flow. So remember we were talking about flattening the curve and the social distancing and restrictions and shutdown, which was never really complete, is done for a temporary period of time for the purpose of regrouping, getting more personal protective equipment, getting people vaccinated. It seems that in China, it was just a very, very strict, extraordinary lockdown where you lock people in the house, but without any seemingly end game to it. If the end game was to, let's get everybody vaccinated, including and particularly the vulnerable, then you could see how a temporary lockdown like that, but they went into a prolonged lockdown without any seeming purpose or end game to it, which really doesn't make public health sense.
Do you understand their vaccination strategy?
In many respects, Chuck, it baffles me. I mean, they
refuse outside vaccines, right?
Yeah,
they only use their own. Right?
Yeah, which clearly, with all due respect, was not particularly effective at all compared to any of a number of the vaccines that were available. But also, interestingly, they did not, for reasons that I don't fully appreciate, protect the elderly by making sure the elderly got vaccinated. So if you look at the prevalence of vaccinations among the elderly, that it was almost counterproductive. The people you really needed to protect were not getting protected.
It's almost as if it was a strategy.
Well,
I mean, I hate to be putting in those terms, but an authoritative regime like that, it almost looked like a strategy, not a mistake.
Well, I don't know what it was, but it certainly, from a public health standpoint, didn't make much sense.
Now, there would be one theory as to why is the Chinese government acting so peculiar and weird, and they still have not come clean on what they can tell us about the start of this pandemic.
Yeah, that is true, and that is, in some respects, and I don't mean this in a broad, pejorative way, but in anything that we've had to do over decades, whether it's bird flu, H5N1, H7N9, or the original SARS in 2002, even when there's nothing to hide, they act in a suspicious, non-transparent way, just probably because they don't want to make it look like there's a blame. When the reality is, if something evolves in your country, it's not to blame, but let's find out what went on so we could be transparent about it and prevent it for the next time happening.
What can we do to once and for all sort of figure out whether the lab leak is a viable theory?
Well, the only thing that can be done is to have an open, transparent interaction with their scientists and our scientists. Get in there, look at the epidemiology, look at what went on there, look at what happened earlier on, maybe a month or so earlier. That has not been at all transparent enough for us to feel comfortable.
Where are you on this now? I mean, everybody's always curious. Where is Fauci on the lab leak theory?
I have a completely open mind about that, despite people saying that I don't. I have a totally open mind about that. But if you look at the preponderance of evidence that has been accumulated by international group of highly respected evolutionary virologists, They feel, and they've written peer-reviewed papers on that, that the evidence strongly points to this being a natural occurrence of a jumping of a virus from a bat to an animal species to human. Hasn't been definitively proven, but the evidence on that is pretty strong. Having said that, we still all have to keep an open mind as to what the origin is.
Is this country ready for another pandemic? And are we still in the one we have not, that we've been talking about?
Well, we certainly are still in it. I think you just need to look at the numbers. We're still having between 300 and 400 deaths per day. So I think the idea that, forget it, this is over, it isn't. We're going into the winter right now. We have the wherewithal to mitigate against another surge. It's up to us to make sure that doesn't happen. And that's the thing that's very frustrating, Chuck, among public health officials, including myself. We have an updated vaccine booster that we want to do, but the uptake of that is less than 15%. It's somewhere between 11 and 15%. We've got to do better than that.
I asked the former Vice President, Mike Pence, who you worked quite closely with during the start of this COVID pandemic, sort of how you became so vilified on the right. Here was his answer to me.
The problem was, I believe that Dr. Fauci ultimately aligned himself with many Democrat governors who took what were temporary policies and made them long-term policies in their state. And the American people love freedom.
What's your response?
Well, I respect the former vice president. We got along very well in the White House, but I disagree with him. I don't align myself with anybody, Chuck. I'm a physician, I'm a scientist, I'm a public health person. It doesn't matter if you're a Democrat or a Republican. I go by the public health principles. Those are the recommendations that I made then during the Trump administration, and the recommendations I make now during the Biden administration based on good public health principles. So I'd have to respectfully disagree with the former vice president.
Well, people that don't know your legacy, during the AIDS crisis, you were vilified by many then. And over time, people sort of understood what your role was and what it wasn't. What do you feel like your legacy is going to be? How do you feel like history is going to treat your time?
Well, just very briefly, the so-called vilification with the AIDS activists was entirely totally apples and oranges.
And I know it is, but my point is like you've been the target before from different
because I have found myself through just circumstances being in the middle of some public health crises that had a great deal of impact on the American and global public. So I would think that if people really look at history and what we did with the activists back then, how we became from adversaries to collaborators and people who made things happen in a very positive way, I hope to be remembered for what I've tried to do, just bring science and medicine and public health principles to very serious crises that we've had. And as I've said before, I've given it everything I have to do that, back from the 40 years ago with HIV to the current situation with COVID, with Ebola and Zika and everything else in the middle.
Look, the reason we kept having you on is you speak English. You don't speak scientist, which is always, I think, very helpful, having a clear way of communicating. Do you think our politics is so divisive, though, that somebody in your position just can't succeed anymore?
I'm very troubled by that, Chuck, because through all the crises I've been through, I've never seen the intensity of the divisiveness now. And if you look at public health principles, it just doesn't make any sense how you could have a divisiveness where ideological principles or ideological bents have people make decisions that have impact on their lives and the lives of their family. How you could have red states be under-vaccinated and blue states be well-vaccinated, and the deaths among Republicans versus Democrats are dramatic. If you look at the curve, it's tragic. As I've said before, as a public health official, I don't want to see anybody suffer and die from COVID. I don't care if you're a far-right Republican or a far-left Democrat. Everybody deserves to have the safety of good public health, and that's not happening.
Well, I'm glad we have the tools. Dr. Fauci, thank you for your public service.
Thank you very much, Chuck. Good to be with you.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.